So the study was designed to look at the effect of adding a co-located and personalised stop smoking intervention to a lung cancer screening programme. It's funded by Yorkshire Cancer Research, and it's nested within the Yorkshire Lung Screening Trial, which is a big study looking at outcomes in the UK. So we were set up so that every eligible smoker who attended for lung cancer screening would be offered an immediate consultation with the stop smoking advisor. We did this on an opt-out basis, so that basically unless people specifically refused to come and see us, they would come and have the initial consultation and then make a decision if they were going to proceed with stop smoking support. So we offered behavioural support, so a one-to-one counselling session, and that was accompanied by pharmacotherapy, so nicotine replacement therapy, and or e-cigarettes and vaping supplies. Or if people preferred, we'd refer them back to their general practitioner for varenicline or bupropion drugs. So we conducted this with everybody, and everyone that was willing got the same treatment for the first 4 weeks. At 4 weeks, we saw everybody back again. We measured their smoking status, and if they'd quit smoking, then we used something called carbon monoxide validation to validate and prove that they'd successfully quit. And at that point, we offered enrollment into the YESS study. So if people consented, they either entered the usual care arm, which was the same support that they'd already had for another 8 weeks, so 12 weeks in total. And our intervention group got exactly the same support as the usual care. But in addition, we used our personalised intervention, and that contained images taken from their CT scan, so images of their heart and images of their lungs, accompanied by scripted advice from the smoking cessation practitioner. And then we followed everybody up at 3 months and 12 months, collected smoking status, psychological change variables, and quality of life and healthcare usage. So that was our kind of methodology.